Hi everyone. Welcome to the ZamChat Podcast. So we are here at Minachi Exclusive Lodge in Chalala. Yeah, very nice place. And today we are joined by Dr. Kuku. Doc, we were just chatting earlier on about how COVID-19 affected people in so many ways. Did it ever have an impact on you, like in terms of you being attached maybe to a particular patient, being able to see them through, like, and then perhaps maybe they don't make it? Because I had I was having a conversation with a friend of mine. His name is Steve.
Yeah.
He had an encounter with this particular patient during COVID.
Sure.
And he became so attached to this patient, so much that after the patient died, like due to COVID-19, he became depressed for quite a period of time. It really affected him, like in a negative way, mentally. Did you ever like have such a situation during the COVID? Because COVID had an impact on everyone, especially doctors. I think doctors, nurses in the healthcare sector, I think the impact was quite high. Did you ever have such?
Yeah, actually, thank you for inviting me to today's program. And I think it's a very important thing that many have not actually addressed. And we kept on addressing the effect that it has had on the world. And we regarded healthcare professionals as heroes and a bit godly, forgetting that they are human. And even most of the interventions you will see were targeted towards patients' psychological needs. They need counseling. They need to be walked through that trauma, the community, those that lost the loved ones and the like. And it was least addressed to the healthcare profession. And during that time, it was not only the trauma that we saw within these COVID centers and just, treating patients, be it inpatient or outpatient, but also there was more trauma losing your colleague that you worked with for a few days. They caught it, and the next day you hear they're no more, or they're being wheeled into the COVID center in the state that you usually see your patients, and you are there to see them take their last breath. That in itself was so traumatic that some of us still live through that. And least I can say is there are really, really few people in the medical sector that have undergone that trauma, post-COVID trauma treatment. And most have just had to brave it through and just, live through it. But it's a very important thing. And these scars are not something that fade off just within a minute. They live forever, and we still feel them. There are times that you sit down and you reflect and see certain flashbacks just hit you, and it takes you into a different, just thought pattern. I still remember patients who would, it's not something that's uncommon, but there was a time that would run out of oxygen. And you have this patient that, you've been interacting after a few days, and they become, your environment becomes your family at the end of the day. So that includes the patient. And our training is not just to see the patient as a patient, but to assess and help them in not only the physical, but also psychologically, emotional, and the like. And that is why we are able to counsel patients and the like. So you're seeing this patient, oxygen runs out, you go there to try to keep them calm. Because the more calm they are, they breathe less and they utilize less of the remaining oxygen. But the panic is there. And it's not something that you could easily just turn off. And it requires you to talk. So you either hold their hand or they hold your hand. And in that moment, this patient continues to beg that you turn on the oxygen. The oxygen is normal. And you can simply feel that grip just reduce with every minute. And finally, they let go. That still replays in my mind.
Are there like in our Zambian setup? Because I was watching a certain documentary about like nurses and all the doctors and other healthcare personnel, like in the US, who like after the COVID they went through like depression and did go through some kind of therapy. Do we have such in Zambia, like where maybe as healthcare professionals, especially after the COVID, because it really hit them so bad in terms of mental health? Is there like a place where you can go? Like, do we have such a program or something?
We have specialists, psychiatrists, quite good and doing remarkable things in the medical space. And the issue of post-COVID trauma, psychological counseling or just treatment and all, is something that was talked about. But I don't think it was implemented to such length. And most individuals would just do it on an individual basis, not that the program was, calling for all those that had need. Remember that some people will not come through, but it requires a colleague or a family member to see it through. Mm-hmm. You could just have your partner see you just wake up from your sleep at certain times, and that could be the only thing. And these are people who needed to find, or we needed to create a space, a safe haven, where they could come without being judged, without, that they could, just bring the problems, that you could treat them and have the specialists look at them. But I didn't think we didn't reach such a level.
Like what you're saying, I ask this because, Doc, I think in most cases, when you talk about a doctor, the way people view a doctor is like, it's almost like you are like a god, or something. Like you never really go through anything. You know what I mean? People view you in that way, and I think it could be a little bit difficult as well for like somebody like a doctor to be able to come out, because people view you a certain way, like you don't normally go through this, like, and I don't know what you think about that. And maybe the challenges also could be that when people view you in a certain way, is it difficult to come out like as a medical doctor? Let's say you have like a depression for instance.
Yes, remember that we are trained in such a way to be kind of brave and be strong at all times. You're not only strong for yourself, but your patients around and just the community. So that in itself, I think, is a good thing, but also a bad thing individually, because you end up being strong when you're not supposed to, mm-hmm. for your sake. Mm-hmm. It's very important to carry, that braveness in certain situations, emergencies and the like. But when it comes to your own personal health, you regard it as the last thing. Okay, you could have a cough going on and you'll be like, I'll just, just walk out of it, when it's becoming like more serious. And also colleagues and peers. Mm-hmm. That's just a cough, because you're seeing worse things. So there's that scale that you're comparing, like, dude, that's just a simple cough. Come back to work.
It's just
okay. Mm-hmm. Then something that's not also addressed is self-medication. Mm-hmm. It's common among health professionals, mm-hmm. where I get to treat myself. Mm-hmm. That's wrong in itself, but it does happen, and that's the reality. Mm-hmm. Okay, so it's a cough, fever. let me take some antibiotic. Okay. Now, remember that me treating myself, I'm not being thorough and I'm not being objective. It's the same reason why we don't advise treating our own relatives. Because, for example, if I'm doing a surgical operation on my relative, just a tiny gush of blood, I may respond in a different way. I'll be too serious and too aggressive when I don't need to, because I know this is
because of the emotions.
The emotions are involved. But if it's someone I'm not really attached to, you see, I'm going to be all professional and take it lightly. Okay, so there are all those things. Then you can have an emotional breakdown if you see that you're losing your loved one. So it requires quite a lot of mental strain in that area. And that is why sometimes if it's your colleague who's not well, you could enter, no, how's the cough, this. Then if you have a relative, I'll be like, oh, are you able to take care of my mom? Then I sit aside. He'll be more objective because there are certain questions I may not ask my mother because she's my mother.
Yeah,
if it's my sister, maybe I may overlook certain things. Even simple questions like, are you sexually active? Maybe I may think, no, I don't think she is. She's just 16. So I will overlook to ask such a question. And even if I did, she will be like, oh, this is my older brother. And she will avoid it. Maybe that's the most important thing towards making the diagnosis. So even when I refer this young sister to a colleague, my colleague needs to stress that whatever they do. So the doctor has to be confidential and actually stress it out to my younger sister that everything we discuss will not even be shared to your older brother or mom unless you give the authority. So that puts your younger sister in that, safe place that you can discuss all little things. But what we also realize is our siblings run away from where we work from. Why? Because they think that if they came, for example, at UTH and saw someone, especially in something to do with, STIs and the like, that colleague would tell me. But that's not it. It should be stressed that each and every doctor regards confidentiality. That's our moral code. And we shall not share that information unless you allow us to.
So Doc, you know so many things, huh? You can break so many marriages, huh?
We forget. As soon as you leave the office, we forget. So your information is safe. It must be erased.
So many marriages can be broken. Have you ever? What's the weirdest thing you've ever come across or you've ever seen as a doctor?
As a
because I was checking the internet the other day. I think there's an article. I think like the weirdest things that a doctor has ever seen. I think this doctor came across. I think they were doing a surgical procedure in their stomach or whatever. Then they came across a knife.
So that's common, especially with patients who are in psychiatry, like psychiatric patients who are admitted, because they have certain behaviors that lead them to eat anything. They could eat nails, like steel nails. They could eat metallic things. So you tend to find those things. Yeah. So that
it's quite common. Eh?
It's quite common. So there are a lot of weird medical diaries that are there. Yeah. How do
you get into medical school, Doc? Is it always something you ever wanted to? You always wanted to be like a medical doctor? Okay, but anyway, being a medical doctor is almost every kid's dream, is it? To be.
Not really. Not really.
Not in your case?
No. I think the world has so many interesting fields out there. which important even to make the world as it is. That should be stressed. Well, what is my story? My story is after I finished my high school, I had two paths that I wanted to follow. Yeah, and most people don't know this. I wanted to either do architecture or aviation, like be a pilot.
I wanted to do maybe because I was influenced by Prison Break, because then I wanted to do architectural engineering, like Schofield.
So at that time, only CBU was offering architecture, but I didn't want to go to CBU.
Is there any other school that's offering architectural engineering now?
I haven't done the research yet.
In Zambia, it's CBU, right?
Yeah, but during that time, I didn't want to go to CBU. I don't know, maybe it was because of the competition in high school, like everyone is like, Unza. So when I realized that Unza doesn't have architecture, I had to fall on my second option, which was aviation. And I did apply. So I applied one of the schools in SA, was picked, but I was supposed to start the following year. So then my dad was a lecturer at Unza, so you know that influence. It's just like, no, you need to get a paper at Unza. Regardless.
So you could have been a pilot, as you're speaking right now.
Yeah, because, it's not too late. That fire is still within me. And it's one of those things that I still want to pursue. I have been in touch with, there's a new aviation school in Zambia, private. So we've been having some discussions. So maybe my dream may be realized in the near future. It's just that I've been busy lately. So at that point, I did not know that he had done some applications for me.
So he applied on your behalf?
Yeah. So within, I think, the time they were doing all those getting applicants, and like I said, you've been accepted in School of Natural Sciences. And luckily, you have a room. So it's either you want to commute or you go in school. I'm like, but next year I'm supposed to go this side. I was like, no, there's no harm. It actually keeps you busy.
Did he trap you? Did he just trap?
Yeah, I realize it now. It actually keeps you busy because it's like A-levels. First year is like A-levels. So go there, keep your mind active, and those are the same A-levels you'll be doing when you go do your aviation program. So I was like, oh, okay, let's jump on it. So first semester comes, you do well. Second, then by the time now it was time to go, that's when I was selected to go to Medquota. So he's like, so do you really want to go this side? Why can't you just finish this and push?
He blackmailed you.
So eventually that's how I got to be University of Zambia graduate. But all in all, I think we need to work on career guidance. I think that's something that's not being expressed. I did see the changes that Ministry of Health, Ministry of Education has done in terms of curriculum. And I think we're discussing with colleagues over career guidance. A lot of our children, or even just people, end up in uni without knowing what they're doing and what the field entails. And if Ministry of Education can do a thorough research, you'll find that there are many individuals who've done an undergraduate course, go into the field, go back, start another course. That should tell you something. That should really tell you something. One, it could be students that were on bursary, it could be, so that's one, wasting taxpayers' money, because you're not guiding these individuals. You're also wasting career span for an individual who would have been excellent or excel in one field for 10 years, but 4 years is
Well,
in
yeah,
this field,
you know,
5. So we need proper career guidance. I do remember we had a career guidance in my school, who was a teacher as well, which is important. But I can tell you, I don't know which school, they're never available. So you catch them by chance. And when you catch them, they had, with all due respect, but they had not researched so much about certain programs.
Yeah, you know,
Okay, so
most of the
they're
people that I
limited
know,
to law, medicine, this. So it's not everyone who will become certain things. There are so many amazing professions out there that even Zambia is lacking, and jobs are there.
most of the people that I know are into a profession that they really don't want to be in, but they've just found themselves in that situation. And I'll tell you now, like, let's say in nursing, in the past maybe 5 years or so, people have been going into nursing just because so they can get a job, because it's like it's easy to get a job as a nurse than maybe as a teacher or an accountant or anything like that. So you basically just go in there just so that it's easy for you to get a job. But you are in there, and I think also, like in the medical field, that is very critical, because you're going to be a nurse, but really it's not your passion. And maybe those are the ones that don't treat patients properly, don't, you know, are always frustrated. And I feel like it also borders and affects the delivery of healthcare as well, especially if you're going to go in the healthcare industry.
Sure, and that may be one of the factors that could contribute, but there are several factors. Before one embarks on any career, they should understand the end point. They should understand the challenges in that field. Okay, because once you're prepared about how the challenges are, if you want to go into medical, there'll be long hours, there'll be this. You need to be a people's person. You need to put other people first as opposed to yourself. So all those things have to start from somewhere. And I feel the start point is maybe high school or even before. And we need to maybe ask the Ministry of Education to look at also curriculum when they're training teachers, because they need to also have an ability to read students' potentials and interests aside making those grades. I may not get a 90 in a certain course, but we all know that students spend more time at school than home. Children end up having that characteristic of themselves at school than home. And that is why we say the community builds the students. And that's why some parents will be so shocked to find that their child is doing certain things. No, it's because this child is being groomed by the community. And where in the community? The schools. And that's why a teacher becomes a very crucial individual in the community, because they are the ones that are shaping our children. And they become a pivotal individual who can identify that, oh no, I think Joe likes swimming. Okay, if we can push this child into swimming, this child is going to represent the country. This child looks like they're always playing and assembling things. Let's stop them from taking social studies. Let's push them into metalwork, GMD. Then let's start already discussing with available universities for them to pursue engineering. Let's start telling them about what engineering entails and the like. But we don't have such a platform at that level. And yeah, so that needs to be brought in quickly so that we have our future leaders or countrymen and women to be in the right fields. So I feel Ministry of Education has to take this task and put it where it needs to be. We are lacking in that space. Our children at that age have easily, pressured or influenced by peer pressure. So if we finish grade 12, if I hear Joe is going to Apex, I'm always so going to tell my parents, I want to go to Apex. But I don't even know what's there. No, because my friends are going there. So, this young ones will be like, oh, dude, I'm going to Unilas. Are you coming to Unilas as well? So you tag along. But you don't know, maybe your individual has done more research on
what they're going to do.
Yeah, but if that starts at the beginning, you find as you graduate, you'll go, dude, you've always known I'm an engineering person. I know I'd love to be with you at Unilas, but I'm going CB. Because that has been sinking through and you've been mentored. So it's very important that should be taken through.
Because I know just very few people whereby who really knew what they wanted to be early on, like when we were kids. Like I've got this friend of mine is in the Czech Republic now. When we were kids, I don't know how old, 6, 7, he wanted to be a medical doctor. Like he didn't have any other dream or choice and he's truly a medical doctor. He's followed like what he wanted to do, his passion. But I think, like you're saying, it would be important to have those career guides. But also, even as parents, we should be able to like identify that in our children, where we say, okay, where is the strength? The strength lies here and there. Because for the reason why I'm saying that is because when we were growing up, and maybe now I think things are changing a little bit, but when we were growing up, any other thing apart from maybe being a medical doctor or being an engineer or being a lawyer, any other thing was considered not important. So every kid just wants to be like that, but maybe deep down their heart, but it's not really the thing that they want to do. But maybe as parents, we should be able to notice that in our children as well, be able to nurture what they want to do, encourage that diversity.
Yeah, and you're right. Well, if you look at a career guidance in school, they don't just interact with the pupil at that stage. They go beyond that. They also discuss with the parents. They give them a report. We have noticed that Joe likes water, that does this, and this is the direction we'd like to mold him to. So it becomes now that whatever is being echoed in school is also being echoed at home. Now, you will realize that not all our parents had reached a certain level of education. Okay, so as much as parents become a good space to help us motivate and the like, some of us were are in families where maybe mom did not get to grade 12 and the like, so she also has, or dad, they have limited knowledge about a certain field that the school can mold you into. But the school becomes the center of knowledge in any other field. Okay, it is no excuse that a career guidance would not know geology, just barely, would not know any space. If they don't know, they look it up and read, because they have the ability to do that. Why? Because they want to give the right information to these people. Then they can deliver it with the parents, be it learned or not, in a certain way that even at home, the parent is able to engage at that level and continue, pushing that fuel into this child so that they become what they need to be. So they should be that unison in all these aspects.
Yeah. So now, Doc, after uni, after med school, you're now a doctor. Then you decide to go and do an MBA in what? Healthcare systems?
The healthcare management.
Healthcare management.
So really,
that's a switch.
My journey to doing an MBA in healthcare management actually starts in my 6th year to 7th year. It was a risk because that was towards my end of final exams of med school.
Mm.
So I remember there were even times that colleagues would be like, "You're going to fail. You're loading yourself with something."
Oh, so you are still in school,
Yes, I had not.
and on the side you start doing the MBA.
Yes. So I think I did realize by 5th year that the clinical route was not giving me that fire.
Ah,
Yes.
you know what? What you're saying?
Again,
Yeah.
I'm doing
career
guidance on my own.
I resonate with what you're talking about.
Yeah.
It's the same situation that I find myself in. Like what you're talking about, it doesn't give me that juice.
Yeah.
The clinical aspect of it.
It's very good,
Yeah.
and I feel I'm good at it even now. But it doesn't. You need that individual satisfaction in what you're doing, or else you have, that emptiness in you. So by 5th year, I did realize what are the options for me when I'm done. I'm going to do internship, rural hardship, then specialize and back to the ward. Then what next?
Then what?
What next? So then I looked at the 4 possible disciplines that are major in medicine: peds, surgery, you have medicine, and obstetric. I kind of loved all of them and didn't hate any. So then where do I go? So then as I looked at the different things during uni, I would try to spark into entrepreneurship at a small level. I remember at Ridgeway campus, I should have been the first one to bring in a popcorn machine to just, raise
To the
some
campus.
funds. Yeah. So then I brought in an ice cream machine. So we'd work with, students, and, I'm in campus, but doing 1 or 2 things. So I was like, okay, I need to also understand this business thing. It's not about just, you invest and the like. So I thought, what else can I do? An MBA. But when I realized there's also an MBA in healthcare management, I thought, okay, my undergrad was going to be health related. Why not see how the 2 fields can be made? And I've never regretted since. It's a new field of business that I never saw. Different dimensions, different things. You could be a businessman, but you need to realize what business etiquette is all about, and certain principles that will enhance certain things within your field. And since then, thank God I did manage to pass that year, regardless because the exams were clashing on both sides. The University of Lusaka and Unza. So after writing this side, I was already writing my other exams this side, but thank God I made it in both. And yeah, we are having an MBA in healthcare management. And so far, it's something that I've been trying to explore and gain more experience in.
And what would you say, having an MBA in healthcare management and you being a medical doctor, when you combine those two, how do you say you've been able to sort of like function or sort of like work and be able to see the world in a different dimension? Because if you're just like you were saying, you go into the clinical setup, it's almost like you just have like a clinical mindset and that's what you're thinking about. But when you mix it with an MBA, you sort of have also like a third eye or something like that, and you see things differently.
You see things differently. By nature, when a medical doctor graduates, they're a manager. Just by that, they're a manager because they're managing the what, which is, and that's why they call them junior resident officers, because he's an officer and within that space you have junior cadres who are the nurses, clinical officers, medical associates, down to the help who was able to keep the environment clean. So you are managing those individuals. Now, as a manager, you need the knowledge and skill. But I will tell you that this is now, I think most of this is being, the management and leadership aspect is being brought into the medical career, because they expected that you being a doctor, you will manage. But not everyone is a manager. You need to train a manager. Okay, there are people who are born leaders. That's a different aspect, because most people mistake the two. A leader and a manager are two different things. Okay, so managers need to be trained, and because most doctors have not been trained to be managers as their first post says, you find that they don't know how to function, not in terms of competence to make a diagnosis, but to work with people. And manage your nurses, manage everyone. How do you do conflict management? So me doing the MBA like opened me up to a different avenue, and I saw how important it is to learn these management skills as you are in the position that you're supposed to be. So it's also one thing we don't also realize is that as much as we are managing these patients, we forget to look at the natural resources, which an MBA will tell you that resources are scarce. That's the number one thing. And you need to make sure that you treat each resource in the best possible way. And you will find that over time, I could be managing 3 people. Okay, I would rather discharge this patient to avoid being admitted, because I can still cure you as outpatient. But another person will be like, let me keep that. One thing we don't realize when we go to the hospital, and this should be understood by not only the health professions, but even just people in the community, is that when you're admitted on that hospital bed, the cost that comes with it is not something that people even think about. One, there's the cost of bed space at the hospital is incurred. Okay, there's the cost of cleaning that linen every day. There's the human resource, a nurse coming to check you out, a doctor, any other cut. There's the help, who's making sure your environment is clean. There's the medication. Okay, there's the drips. So if you put into perspective, and that is one of my dissertation that was looking at the cost that the hospital ministry would incur if a child is admitted in deep law, because we don't put this into perspective. You will realize that it's not even less than you would spend a night at Protea. Imagine that. But every time you are in the hospital, you think it's free. The hospital is bleeding. So, having that management perspective and considering that the hospital is not funded to 100%, I, as a manager down there, need to understand that if I admit someone prematurely on the ward who can do well outside, I'm actually bleeding the hospital, bleeding the Ministry of Health indirectly, and the nation at large. So sometimes we lose finances or resources through just this management aspect. So if you're thinking on it in that direction, it's a different view.
It's a different view, yeah.
It's a different view.
It's a different view. And so now you do an MBA, you're done, then you find yourself in insurance as a consultant in medical insurance. What basically do you do as a doctor who's done an MBA? Then you find yourself in medical insurance as a consultant.
Okay, so when you look at the whole training for an MBA in healthcare management, you are learning how to manage the whole healthcare system, from the smallest facility to the Ministry of Health itself, and being a stakeholder in the management of the entire country in terms of health, which medical insurance is part of, and it's something that we did. So as a consultant, I've been more vested into being a medical insurance adjuster. What that means is that I get to look at, I think people who do not understand about insurance, this is what happens. When you sign up with a medical insurance as a client, you're given maybe a card or whatever biometrics they use to identify you when you go to the hospital. So when you go, say, to a hospital, be it CFD.
I've got this thing about insurance companies, just in general, not talking about health and anything like that, is that the model that they operate on, like, it's like, if it's like kind of a little bit like gambling, because you can correct me if I'm wrong. If you have a company and then there's let's say 100 people on premium,
Sure.
maybe they're paying 20,000 kwacha and everybody gets sick at the same time. Isn't that going to crash that insurance company?
Yes, it's more like
Which is okay.
to give the insurance company trouble. Maybe we can put it in that way. But every insurance company, before they come on board, or even just have one client on board, there are certain things that they need to make sure that they have. And one of those is making sure that they can take the risk. And the risk will only be understood or you'll be granted license if you have enough either assets or capital cash that is sitting, that should that eventuality happen, you're able to, pay your bills and the like.
So you're like, as an insurance company, you're like supposed to invest in other vehicles that can...
Not really. Before, if you want to sign up medical insurance right now, I think PIA requires you to have 12 million in assets or
as a company, if you're opening up an insurance company, $12 million kwacha.
Yeah.
Okay,
that's roughly between $500,000 to $600,000.
Okay, I see. I think that protects the company.
So that now is,
in case it's rare though, but
holding that risk that if something goes wrong, you have the financial source to actually bill yourself and pay each client. Okay, what the dues are. So once you have that in either assets or capital cash, of which I think should be like 30% to 40% should be in monetary form. The rest can be assets. So you set up, then you start collecting this premium. And we saw this during COVID. Almost every medical insurance,
they were limping. Because I saw,
was limping because now there was a spike in how many people were being admitted.
That's why I say this, because Doc, you find that that's where people start now becoming skeptical about insurance companies. Then sometimes they take so long to try, because of that, like if they're overwhelmed, they start to take long maybe to give you your claim or whatever it is. If you to take maybe three months or so to get your claim, or if maybe you used your money or something like that. That's where I also feel like, apart from what we talked about, people feel because of that, it's one of the reasons why people don't want to, because sometimes they feel like insurance companies are like a scam. Drama is, but then the time that you're not feeling well, then you start fighting. They start like, I'm not sure why insurance companies are like that.
So, well, you have the right to report that particular insurance company, but what the regulators do is, from time to time, they regulate these insurance companies. And not just you having the 12 million startup capital, the monies that you are getting, they are safe investments. that are done to multiply the money also. That is approved by the regulators. You can't just get the money and invest it anyhow. It needs to be approved. So to any client who wants to do medical insurance, any medical insurance company that you pick by choice, make sure you ask for their license and all those things. That tells you that this is a well-accredited institution and you have no, panic or things that will be at the back of your mind that you may lose out.
And I understand, Doc, that I don't know whether you're done or are you still doing family medicine?
Yes. So that's one of the clinical specialties that I've settled for. Yeah. Now.
Why family medicine?
Well, over time, like I said, I didn't have that, realization that I would settle for any one discipline. So with that said, and I enjoyed almost everything. So family medicine just, speaks to me because it deals with everything. So this is a specialist who sees from birth to death. That's how we call it. So I'm able to see a child, I'm able to see a teenager, I'm able to see an adult, I'm able to see the old. Okay, I'm able to see people struggling with chronic illness, cancers. I'm able to help in pain management. I'm able to do any kind of specialty. I'm able to have an input in it. So the mother who was doing antenatal and just prevention. So family medicine is the only specialty, even right now under UMZA, that's in public health. That tells you that this is a specialty that is more inclined towards prevention than curative. And well, the way to go is prevention than curing. Because curing, you'll be chasing diseases. You're like chasing them to cure them. But with prevention, it's like you're going before they even start and cut them off. So I thought that is more speaking to what I want to do. And that is why.
So now I think what you're talking about being like encouraging prevention than treatment. When we were growing up those days, Doc, it was very, very rare to even hear like somebody who has high blood pressure, hypertension, for instance. Used to call it BP. We just used to call it BP when growing up.
Sure.
But now, then it was normally adults. Yeah, old people. But now you find a 25-year-old young man who has hypertension is on anti-hypertensive medication. What's happening? And this is quite common. It's becoming common. 25-year-old, 26. They're on.
Well, I think it's everything. Almost every condition is due to environment and lifestyle. Basically that. It's environment and lifestyle. If you're going to have an STI, it's within lifestyle. If you're going to have COVID, it's in the environment. If you're going to have TB, environment, lifestyle. It all plays on that. And this is why we emphasize that, look, before globalization or mixing of different markets, the travel and the like, if you go 5 decades ago, was different from now. Okay. What someone is doing in the US, you're able to pick it up even on different platforms, Facebook, TikTok. Okay. And you're able to order certain things that people are doing in Europe. For example, the new trend of electronic smoking, shisha. If someone is going to discover shisha in Europe and they post it, within seconds, someone in Africa is watching it. And you could order it and within 5 days it's in Africa. So now the diseases that we saw in Europe because of the environment and lifestyle is what we're catching up to. Okay. You will also attest to the fact that during our time as children, the only thing that we knew was going to play soccer, climbing trees, and the like. Kids these days will be just seated in the house, watch cartoon, or play video games. Now, it's not only the kids' fault, it's also our parents, us, because our generation is more nuclear than extended. You could be in a community where you don't even know your neighbor.
Yeah.
Right now.
Right now, yes.
And you wouldn't want your child to even be outside. Then I would move blocks that if my parents realized that I was where I was, they would be in panic mode. But they would not mind. Why? Because then the community was regarded as the parents who are treating. Because I could be in Chilenje, that's where I stay, but I'll find myself in Woodlands or Roadspark playing. And if I did something wrong, at that point, any older person who passes by could actually catch me, spank me, and tell me that's wrong. And even if my parents heard about that, they'll be like, yeah, that stranger did well. Because what we had is adults were actually molding any child that they see.
Yeah, they can even spank you. You
and
know,
they even take you straight to your mom where you're crying that I found him playing this way and I beat him, and they'll be like, they'll even shake hands.
Yeah,
imagine
that was crazy.
But now,
your friend's mom would beat you, and your friend, she would beat you and take you to your mother's place.
Yeah. But now we're in a situation where even a well-known teacher that you know should kind of have some form of discipline. If that teacher touched your child, you would sue the school.
But Doc, like, if you look at diseases like cancer, for instance, even when we were growing up, very rare, or maybe the diagnosis wasn't there, I'm not sure, but it was quite rare. But now it's so prevalent.
Yes, so there are multiple.
It's not just in the city. Even the hypertension we're talking about in young people, even in the villages where maybe there's no hungry lion or anything like that, but somebody has got, at 27, someone has got hypertension.
Well, we've changed over time. If you look at lifestyle, the foods that we're eating, we may say that no, in the rural areas, there are not these things are reaching as far as that. Also, activity. Okay, during our time, most of us would walk to school. Obviously, not the 10 kilometers that our parents would tell us. They were within.
I've got this thing about insurance companies, just in general, not talking about health and anything like that. Is that the model that they operate on, like, it's like kind of a little bit like gambling, because you can correct me if I'm wrong. If you have a company and then there's let's say 100 people on premium,
Sure.
maybe they're paying 20,000 kwacha and everybody gets sick at the same time. Isn't that going to crash that insurance company?
Yes, it's more likely to give the insurance company trouble. Maybe we can put it in that way. But every insurance company, before they come on board, or even just have one client on board, there are certain things that they need to make sure that they have. And one of those is making sure that they can take the risk. And the risk will only be understood, or you'll be granted license, if you have enough either assets or capital cash that is sitting, that should that eventuality happen, you're able to, pay your bills and the like.
So you're as an insurance company, you're supposed to invest in other vehicles that
Not really. If you want to sign up medical insurance right now, I think PIA requires you to have 12 million in assets or
as a company, if you're opening up an insurance company, $12 million kwacha.
Yeah.
Okay,
That's roughly between $500,000 to $600,000.
Okay, I see. I think that protects the company.
So that now is,
in case it's rare though, but
it's holding that risk that if something goes wrong, you have the financial source to actually bill yourself and pay each client. Okay, what their dues are. So once you have that in either assets or capital cash, of which I think it should be like 30% to 40% should be in monetary form. The rest can be assets. So you set up, then you start collecting this premium. And we saw this during COVID. Almost every medical insurance
they were limping. Because I saw,
was limping because now there was a spike in how many people were being admitted.
That's how I say this, because Doc, you find that's where people start now becoming skeptical about insurance companies. Then sometimes they take so long to try because of that. Like if they are overwhelmed, they start to take long maybe to give you your claim or whatever it is. If to take maybe three months or so to get your claim, or if maybe you used your money or something like that. That's where I also feel like, apart from what we talked about, people feel because of that. It's one of the reasons why people don't want to, because sometimes they feel like insurance companies are like a scam. What if drama is that then you're not, the time that you're not feeling well, then you start fighting. They start like, I'm not sure why insurance companies are like that.
So, well, you have the right to report that particular insurance company. But what the regulators do is, from time to time, they regulate these insurance companies. And not just you having the 12 million startup capital. The monies that you are getting, they are safe investments that are done to multiply the money also. That is approved by the regulators. You can't just get the money and invest it anyhow. It needs to be approved. So to any client who wants to do medical insurance, any medical insurance company that you pick by choice, make sure you ask for their license and all those things. That tells you that this is a well-accredited institution and you have no, panic or things that will be at the back of your mind that you may lose out.
And then I understand, Doc, that I don't know whether you're done or are you still doing family medicine?
Yes. So that's one of the clinical specialties that I've settled for. Yeah. Now.
Why family medicine?
Well, over time, like I said, I didn't have that. Realization that I would settle for any one discipline. So with that said, and I enjoyed almost everything, so family medicine just speaks to me because it deals with everything. So this is a specialist who sees from birth to death. That's how we call it. So I'm able to see a child, I'm able to see a teenager, I'm able to see an adult, I'm able to see the old. Okay, I'm able to see people struggling with chronic illness, cancers. I'm able to help in pain management. I'm able to do any kind of specialty. I'm able to have an input in it. So the mother who was doing antenatal and just prevention. So family medicine is the only specialty, even right now under UMZA, that's in public health. That tells you that this is a specialty that is more inclined towards prevention than curative. And well, the way to go is prevention than curing. Because curing, you'll be chasing diseases. You're like chasing them to cure them. But with prevention, it's like you're going before they even start and cut them off. So I thought that is more speaking to what I want to do, and that is why.
So now I think what you're talking about being like encouraging prevention than treatment. You know, when we were growing up those days, Doc, it was very, very rare to even hear like somebody who has high blood pressure, hypertension, for instance. Used to call it BP. We just used to call it BP when growing up.
Sure.
But now, then it was normally adults. Yeah, old people. But now you find a 25-year-old
having hypertension.
young man who has hypertension is on anti-hypertensive medication. What's happening? And this is quite common. It's becoming common. 25-year-old, 26. They're on.
Well, I think it's everything. Almost every condition is due to environment and lifestyle. Basically, that it's environment and lifestyle. If you're going to have an STI, it's within lifestyle. If you're going to have COVID, it's in the environment. If you're going to have TB, environment, lifestyle. It all plays on that. And this is why we emphasize that, look, before globalization or mixing of different markets, you know, the travel and the like, if you go 5 decades ago, was different from now. Okay. What someone is doing in the US, you're able to pick it up even on different platforms, Facebook, TikTok. Okay. And you're able to order certain things that people are doing in Europe. For example, the new trend of electronic smoking, shisha. If someone is going to discover shisha in Europe and they post it, within seconds, someone in Africa is watching it. And you could order it, and within 5 days, it's in Africa. So now, the diseases that we saw in Europe because of the environment and lifestyle is what we're catching up to. Okay. You will also attest to the fact that during our time as children, the only thing that we knew was going to play soccer, climbing trees and the like. Kids these days will be just seated in the house, watch cartoon or play video games. Now, it's not only the kids' fault, it's also our parents, us, because our generation is more nuclear than extended. You could be in a community where you don't even know your neighbor.
Yeah.
Right now.
Right now, yes.
And you wouldn't want your child to even be outside. Then I would move blocks that if my parents realized that I was where I was, they would be in panic mode. But they would not mind. Why? Because then the community was regarded as the parents who are treating. Because I could be in Chilenje, that's where I stay, but I'll find myself in Woodlands or Rhodes Park playing. And if I did something wrong, at that point, any older person who passes by could actually catch me, spank me, and tell me that's wrong. And even if my parents heard about that, they'll be like, yeah, that stranger did well. Because what we had is adults were actually molding any child that they see.
Yeah, they can even spank you.
And they even take you straight to your mom while you're crying that I found him playing this way, and I beat him, and they'll be like, they'll even shake hands. Yeah, they don't even know each other.
That was crazy.
But now
your friend's mom would beat you and your friend, she would beat you and take you to your mother's place.
Yeah. But now we're in a situation where even a well-known teacher that you know should kind of have some form of discipline. If that teacher touched your child, you would sue the school.
But Doc, like, if you look at diseases like cancer, for instance, even when we were growing up, very rare, or maybe we just were not, the diagnosis wasn't there, I'm not sure, but it was quite rare. But now it's so prevalent.
Yes, so there are multiple.
It's not just in the city. Even the hypertension we're talking about in young people, even in the villages where maybe there's no hungry lion or anything like that, but somebody has got, at 27, someone has got hypertension.
Well, we've changed over time. If you look at lifestyle, one, the foods that we're eating, we may say that no, in the rural areas, they're not this. Things are reaching as far as that. Also, activity. Okay, during our time, most of us would walk to school. Obviously, not the 10 kilometers that our parents would tell us. They were within.
Yeah.
There was more quantities. But in all, almost everything that we interact with has a side effect. Regardless, even just water has a side effect. So no one should come out there and tell you that, oh, this medication doesn't have side effects. It's not true.
So, Doc, like, when we were talking about the COVID-19, we talked about how it like disrupted things. It caused a lot of challenges. With the age that we're in now, when you talk of technology, do you think in the healthcare industry, for instance, I'll start with maybe on a global level, are we prepared for another COVID or something more than COVID? Has COVID opened our eyes, or we're still sleeping in the healthcare industry?
It was meant to, or it was supposed to open our eyes, and a lot of countries have quite invested in that area of surveillance, so that they can anticipate another known or unknown disease that will behave in a similar manner, and maybe then will be prepared. And you could also see a lot being done by WHO to make sure that they are not caught unaware. And how do we tackle the next conditions? Remember that it's not all about treatment, identification. It's also about if we need a new medication on board, how fast do we get to approve or fast track certain sports? Well, I think we had that debate with vaccines.
With the vaccines, that's why many people were skeptical.
Take a lot of years, 5, 10 years. How come now you want to develop it within the shortest possible time? So I think that brought up so much insight on certain things have to be changed, certain clauses have to be changed. So health affects almost every stream. Look at how it's shut down in terms of financial capacity of different companies and countries, actually. So a lot, I think, is being done by each and every country, and the WHO is sharing their roadmap to this, that each and every country should play a role. And from different meetings, stakeholder meetings, I believe that Zambia is also on the same track.
Have we been able to utilize technology, for instance, in terms of, because I see you usually do some of those teledoctor, and you do some talks here and there sometimes. Do you think that as a country we're on the right path in terms of combining the traditional way we practice medicine with the coming in of technology, maybe like online consultation, stuff like that? And is HPCZ like open to something like that? Because I know like it's still like old school. I'm not sure with the...
So I think in any field, my take on technology as well as it's a double-edged sword. It could damage or it could do good. Technology is the fastest way to destroy even any platform. It's also the fastest way to push it up, regardless. It's the fastest mode of spreading bad news, and also it's the fastest way to spread good news. So, but in all, when we look at the goodness of technology, we are in a country where the ratio of a healthcare professional and patient is huge. Technology comes to bridge that gap. Okay, instead of me only talking to a few individuals in my consultation room, advising them on health, I could be on a platform like this one and reach thousands. Okay. When it comes to one-to-one consultation, they can reach me in the comfort of their homes. They don't need to walk to the hospital, line up, and the like. And that's where teledoctor comes in, where you can request any specialist or doctor on that platform, and that technological device is going to bridge that gap or link you to your preferred specialist, and they will discuss with you at length, find out what problems you have. If you need monitoring, the technology will monitor you over time. If you need medication, it will easily connect you to a pharmacy that drops the medication at your doorstep. So that in itself is a good thing that also reduces congestion in the hospitals. So aside that, we're talking about prevention. It means that technology can avail so many health tips in the fastest possible time. Imagine way back when technology was not there and someone has cholera in Kenya. The whole of Lusaka, Cheston, Avondale will still continue their practices, even northern Copper Belt, without knowing that there's an outbreak this side that is spreading. But with technology, as soon as we have one, there's an alert throughout, and a lot of people actually heed to health habits and avoid that spread. So technology is a game changer, and it's here to stay. And we need to change our usual way of doing things in order to practice. And HPCZ is on board with it. Remember, their mandate is also to look at the how you store information. Confidentiality is very key. And that's why I'm saying it's a double-edged sword. Because if that information leaks out, you're leaking out quite a lot of huge sums of confidential information for people. So that's why now HPCZ and other regulators, ZICTA and the like, come on board. Before you are on board, they need to look at how safe all those regulations are met, so that you have a smooth way of interfacing with people in the community.
Yeah, I understand their concern. I think I was watching a documentary on Facebook. It's called the Facebook Dilemma, where they're saying information now is the new oil. Information is the new oil. So you can imagine if you have technology on application or whatever, where you are storing so much information about patients, about all that, you can imagine how many people can be interested in such information, having that data. If they can have that data, whatever they can do with it, we don't know. But again, being able to safeguard people's confidential information, I think that's key. Paramount and key and number one. You talked about the doctor to patient ratio being like one doctor. What's the normal doctor to patient ratio?
Well,
I think for pharmacists should be one pharmacist to 1,000. Right, what is it? To 1,000? It should be to 1,000. But I can. But now I think the estimation should be probably 10,000, something like that.
That's over a period of what?
That's I don't know, within a certain. It also has to be within a certain area.
1,000.
Yeah, but the reason why I bring up that is because when we were talking about technology and how it can improve, you find that as a doctor you are overwhelmed, because when you go to a place maybe like UTH, there's so many patients there, so many patients that as a medical professional you are so overwhelmed, because the normal ratio isn't adding up. And I want to just understand some of these challenges that you face say as a medical doctor, for instance, in terms of being able to work in an environment with limited resources, for instance, being able to work in an environment that you are so much under pressure because there's so many patients that you need to look at in a day.
Yeah. It's a challenge, and it requires that mental strength. Yeah, and aside the training, you also have to grow into different environments. And yes, there is a huge gap in terms of patient-doctor ratio, and we end up being overwhelmed. I think there have been articles where people have done research on medical doctors in terms of stress levels, burnout, all those things, and the indicators are there showing that we are actually overworking because of that huge inflow of patients. And it has no formula when you're in that environment, because you're dealing with human life. So be it little resources or not, you have to do the best that you can, because that patient in front of you could be someone's daughter, son, could be someone's father, mother, breadwinner. So that in itself sometimes overshadows what's missing, because all you want to do is save that life. That in itself also overshadows the little energy you have to move to the next hour, because then you have to just gather the little energy within yourself to pull through to see this individual saved. And it's only when you're back home and on your bed that you see that you're really exhausted.
As we close up, because when you talk about being exhausted, and also how just working in that environment, the effect that it has on you. Because I remember my mom was a nurse. She's retired now.
Okay.
She worked in that environment for so long, such that it even affected the kind of food that she eats.
Sure.
Yeah. Does it have such an impact on you?
Yeah.
To a point where
I think you find health personnel, or even doctors in particular, who have bad eating habits, but that stems with the hours of work. Because not to really compare, but you find other obviously ministry lines. If it's lunchtime, we've been to these places like you're in a queue, you're getting your NRC passport. If they tell you it's lunchtime, doors shut. Like they close the doors, we're on lunch, come at 14:30. So you wait. And
but you're not going on lunch.
To get their proper lunch, eat properly, take their water. I'm in casualty. The line
You're
is
not going on
skimming
lunch.
off.
You're going for lunch.
Okay. I do realize that there's some individuals who came as early as 5 because of the queue. They have not been seen. If I go for lunch, that's going to...
Somebody could die.
Yeah, so now you brave yourself through that lunch. Even if someone brought you lunch, it will be just seated there. The time you're knocking off now, you're going, you'll be like, I'd rather eat maybe freshly cooked food. Or you eat the food. So maybe the only thing you have is a bottle of water on the table. You're pushing. So it now just changes your normal eating habits. Maybe you're missing lunch, missing this. Okay, so those are things that the other side that people don't even talk about, because we won't close casualty and say, oh, wait until 14:30. The nurses and doctors are on lunch right now.
Hey, Dr. Kuku, it's been nice chatting with you.
Yeah.
Hoping to have you again one of these days on this podcast. So there you have it. That was Dr. Kuku on ZamChat Podcast. a place where we have meaningful conversations. Until next time.
Thank you.